Everyone, my name is Dr. Al Simeone, and I'm the founder of the Disc Chiropractic located in Wheat Ridge, Colorado. And if you've already downloaded our guide to get relief and prevent neck pain um, guide, then you've already taken the first step towards fixing the cause of your pain and not just managing it. Now, in this short webinar, I'm going to walk you through 7 simple daily habits and stretches that you can start today to reduce your neck tension, improve your posture, and to protect your spine for the long term. Then I'll share which treatments work best if your pain still isn't improving after you've applied some of these techniques. Now, first off, I do want to talk about the truth about neck pain. And neck pain isn't just something that shows up out of nowhere. Usually, it's a sign that something in your spine or your daily habits, they've changed. It might be things like poor posture, hours on the screen, sleeping wrong, or carrying just tension from stress. And all of those can add up and accumulate over time. Now, here's the key. Neck pain is a mechanical issue, meaning it's caused by how your joints, and your muscles are functioning, not just a chemical problem that a painkiller can fix. I hope that makes sense. A mechanical issue requires a mechanical correction, and no chemical can correct a mechanical issue. So, if your spine is misaligned, your muscles tighten to compensate, and the nerves that run through your neck start to get irritated. And that's when you feel stiff, you might feel burning, pain, or even numbness that's going to your shoulders, arms, or hands. So, let's go through 7 simple habits that you can do every day to help your neck heal and stay strong. Okay, so chin tucks. Chin tucks help to strengthen the deep muscles that hold your head into a proper position and proper alignment. So, how do you do this? First, you sit tall with your shoulders relaxed. You tuck your chin straight back and not down. So, straight back rather than looking down until you feel a light stretch in the back of your neck. You can hold there for 10 seconds and then relax. And you can repeat that 5 times, and you would call that one set. Now, a quick tip is to do this throughout the day, especially if you're working at a desk. The more that you train your neck to hold the right position, the less stress that you'll feel. Another great stretch is the upper trapezius stretch. And this is great for tension headaches and for shoulder tightness. So stress and poor posture can lead to tight, overworked upper traps, and this can cause neck pain and even tension headaches. And so you'll perform this by sitting or standing tall. You'll tilt your head to one side and bring your ear towards your shoulder. You can think about it by turning your head at about 45 degrees. You'll use your hand to gently press your head deeper into the stretch as you bring your chin towards your chest. You can hold for 20 or 30 seconds and then switch sides and repeat that 2 to 3 times. Now, a couple tips with this is that depending on the angle of your head, you'll hit different muscle fibers in the upper trap. So the more laterally you're looking, when you look down towards your chest, the more that you'll hit the muscles and the fibers towards the lateral side of the trap. The more straight that you look, just say 5 degrees, 10 degrees, and go straight down and pull down, you'll hit fibers that are closer to your spine. And so you can hit different fibers and different muscle striations by changing that angle. Another good tip is to breathe deeply while doing the stretch. A third stretch is called a wall angel. And wall angels help to reactivate weak postural muscles, especially for those who are sitting in a desk or seated position for many, many hours. And if you can't keep your arms against the wall, then that is a sign that you need to keep practicing. These are more challenging than they look, so don't overestimate them. What you'll do is you'll stand with your back flat against the wall, and your feet can be 6 inches apart, maybe 12 inches apart, depending on your height and your shoulder width. Place your arms in a W shape, and bend your elbows at 90 degrees. You'll slowly raise your arms into a Y while keeping your arms against the wall. And when we say this, your head, your upper back, your elbows, and your wrists should all be against the wall. And you'll keep raising your arms until they form a Y as high as they can. And you can perform 10 repetitions and call that one set. And you can do that, once in the morning, once in the evening, or once when you start your day and once in the middle of your day if you're working at a desk, maybe even once at the end of the day. Now, um, struggling to keep your arms on the wall is again a sign of postural weakness. So after that, you want to look at what are the postural exercises or what are exercises that you can do to strengthen those postural muscles. And that's where the prone back burn Y comes in. And this is for weak upper back muscles that are putting stress on your upper back and your neck. The movement is, again, targeting those muscles to support your body's ability to stay in a good upright and ergonomic position. So you'll perform this by laying face down with your arms extended overhead in a Y shape. And you'll lift your arms and your chest slightly off the ground while squeezing your shoulder blades tight together. You should feel a nice squeeze. You can hold for 5 seconds and again perform that for 10 repetitions. And you can do one or two sets of that. Another tip on this is to keep your gaze straight ahead of you towards the ground. Do not look up because that will put more strain and stress on the neck muscles. Some other great tips are going to be box breathing. And that's because neck tension isn't just physical, it can also be emotional. So there are three forms of stress. First is physical stress, the second is chemical stress, and the third is emotional stress. And stress oftentimes shows up in the shoulders. So what you'll do is sit or stand tall with your shoulders relaxed, back and down. Inhale through your nose for 4 seconds. Hold your breath for 4 seconds. Exhale for 4 seconds. And then hold your breath out for 4 seconds. And you'll repeat that for 4 to 5 rounds. Now, the goal is to pair this box breathing with good posture. So the more that you train your body to stay relaxed and upright, the less tension will build in your neck. Another great tip is your ergonomic setup. Now, I've shot another webinar, a longer webinar on workstation ergonomics, and I would highly encourage you to review that webinar because there's a lot of good information in there to help bring your body position into a good ergonomic position throughout your workday. So some basics are to keep your screen height and your monitor basically at eye level or at the bridge of your nose so that you're not tilting your head up or down. You want to use your chair support. You want to sit back as far as you can using a lumbar support and maintaining a neutral spine. Your keyboard and mouse placement should be at elbow height, and your foot position, your feet should be planted firmly on the ground. If you are someone who uses a phone very often, then it is wise to be using a Bluetooth headset rather than cradling the phone against your shoulder while you're trying to multitask. And so with your ergonomics, small changes can make a big, big difference, just like small hinges can swing a very heavy door. And number 7 is your sleep position. So your pillow should support the curve of your neck. Your back, as far as sleeping, is always the best position to be on. But if you're not on your back, the second best would be on your side. When you're on your side, your pillow should be at the distance that keeps your shoulder and your neck straight. So you're not sleeping with your head pinned to your shoulder or flexed away, extended away from your shoulder. Now, if you are waking up with neck pain, your pillow might be the problem, and a cervical pillow can significantly improve the way that your neck feels each and every day. You do need to make sure that you're getting the right pillow for your type of sleeping, whether it be back, side, or both. And you should also be measured for your pillow to make sure that it is the right size for you. Now, I just want to go over why these recommendations work. Each of these movements, these stretches and exercises, they improve how your neck moves and how your posture holds during the day. And when your spine is balanced, it takes the pressure off of the nerves and the muscles, allowing them to relax naturally. But certain habits can undo the progress. Things like slouching, staring down at a phone or a tablet, or sleeping on your stomach. And even small things like holding your phone between your ear and your shoulder or carrying a heavy bag on one side can create an asymmetry that keeps your neck irritated. So, awareness is the first step. Once you correct these, your spine and your nervous system can finally catch up and heal. Now, if you've tried these stretches and these posture fixes, but you're still having neck pain, then there's usually an underlying issue that needs to be corrected more specifically. And that's where chiropractic and advanced therapies come in. And here's how we help patients every day. We use precise chiropractic adjustments to realign the vertebra, ease nerve pressure, and restore normal motion. Because when your neck moves properly, the muscles and the discs can finally relax. Second is by using shockwave therapy. And this helps to break up stubborn trigger points, scar tissue, and muscle spasms in the neck, the upper back, the traps, and the shoulder areas. It's kind of like hitting the reset button on chronic tension and restarting the healing process. And another great therapy is spinal decompression therapy. For disc injuries or nerve compression, we use cervical decompression to gently stretch the spine, creating more space for the discs. That way your body can naturally heal. Now, these daily exercises and habits, they are an excellent starting point for neck health. But if your pain keeps on continuing or it returns, or you notice radiating pain into the shoulder, arm, or hand, then you should not wait until it becomes chronic because it's much, much easier to fix a problem before it's actually started if you can get ahead of it. And that's part of the reason why we're offering an opportunity to come into the office for an examination, consultation, any necessary x-rays. And we like to take motion x-rays so we can do a pending analysis to actually measure what is moving in your spine when you move and what is stuck. And that's how we're able to precisely pinpoint the problem. And of course, after that, offer a report of your personal health findings. That way you can make quality decisions about your health, whether it's with us or at another office. And we're offering that for only $47 today because you've watched this webinar. So if you are interested, feel free to click on the link or give us a phone call at 720-573-4910. One of our receptionists will be happy to find a great day and time that works for you. So I just want to thank you for your time. I do hope that you find this information valuable. And most of all, I do hope that you apply this information. And if you do need us, our door is always open. So thank you, and I look forward to seeing you at the next perfect moment.